as we celebrate, we want to recognize and appreciate the immense contribution the Catholic Church has done to the health systems of Kenya, supporting and developing health generally in Kenya. And they have so much invested in the health system, where they have got training institutions, they have got hospitals, and most of our members as the associations are coming from the Catholic faith, and we appreciate how they have blended faith with professionalism. It is really something that has really brought a lot of professionalism in their work.
This association helps nurses to become better at their work, and especially as Catholic nurses, to see their work not just as a job, but as a calling and a service to Jesus Christ himself. And this kind of conferences are very important, where nurses from all over, this one is from Africa, we meet to talk about our challenges, our joys, and as we share, we realize that we are not very different, and circumstances in different countries are not very different. But where in every way we can encourage each other and we support each other, and we also bring in new knowledge from our different countries and share, and we go back home very enriched.
The experience has been overwhelmingly joyful, and I've learned so much about love African style, and that means supporting people and clapping for people in many different ways. And we celebrated Mass several times with the bishops here in Nairobi, and it was such an uplifting experience.
And the other thing is they always have their retreats as an association, as their nurses guild. And then that, I think in that way, they happen to be together. It brings them together as a member of their guild. So we're also try and take that back home. That's it, that we have AMA retreats maybe every time, if possible, 3 times a year or per rising need.
As Catholic nurses, we are extremely interested in the well-being of the patient with compassion. So we look at compassion to be our key to our practice as Catholic nurses. And because of that, we have our own way of believing and behaving. Wherever you find a Catholic nurse, you're supposed to be identified and to identify as Catholic nurses.
We need to be empowered with different channels and ways of approaching our patients, both spirituality and also with our nursing skills that we have, that we've already attained from our training. So this is more on the spirituality, looking at our patients differently so that we are able to journey with them all, either in their illnesses or during preventive, or when we are enhancing their health thereafter in their rehabilitation phase.
So it is important for us as nurses, especially Catholic nurses, to go back and plant the seed that has been given to us, especially knowing that if you look at us, you know, it's a profession, there is a vocation. We are following what Jesus did. We know that God is love. Jesus used to look after the sick, and that is what we are doing. And we cannot be looking after the sick people if we do not love Jesus and we don't love ourselves. And it will be impossible for us to say that we are loving other patients.
Perhaps how nurses can encourage one another, and especially knowing how important it is the work that they do in their communities, in their hospitals, how much it is important giving life and nourishing life. And based on that, I've had a very good experience, and then I'm taking home all these good things. I'm going to encourage nurses in my parish to start with, and nurses all around.
We've learned about spirituality. Spirituality is very, very important.
And this is one of the things which I've taken interest in. Even in the UK, we have on our website put something on spirituality, because without spirituality it's very difficult to function as a working Catholic nurse.
We learned a lot about mixing our nursing and our Catholic convictions. We learned about family planning that doesn't use the chemicals, the natural family planning, and also we learned more about, we were revived on our professional issues.
The conference was a perfect one, and I'm quite impressed with nurses all over and those in Nairobi for the hospitality in this CICIAMS VII African Regional Conference. It was quite an exciting brainstorming, and it has taught us much about our profession and the spirituality in collaboration to our care to enhance our patient satisfaction.